Thanks for the invitation to be here. I've learned a great deal over the past day and a half. I think what I'm going to do right now is try to take us into some more concrete components of policy. So in terms of environmental policy, what makes a really good policy? One that takes all stakeholder opinions into account, and we've heard from a lot of different stakeholder opinions, but I think that we can get into that in more detail in the discussion. A good policy is well written, it's concise, and it's easy to understand. And I think this is important when you think about translating to the public. We've also talked about translating research results, translating guidelines to the public. They have a really hard time understanding environmental exposures. And so it really needs to be in a way that they can understand and implement in their daily lives easily. It needs to be realistically implemented, and it's effective in achieving its goal. And I think effective in achieving its goal is really hard. A lot of times we put forward policies at the state or federal level, even at the individual level, and we don't know if it's effective in achieving its goal. It's only years later when we do studies that we understand that it didn't achieve its goal, like telling people to exercise more and eat less. That's obviously not achieving its goal right now. So what are the other components of good environmental policy? Well, we need to consider the weight and strength of the evidence, and Judy just went into that a little bit. But if we don't have strong weight or strong strength of evidence, then what can we do? We can use screens to detect and prioritize chemicals. And then in terms of the strength of the evidence, can we use that to do really good risk assessment? Risk assessment really is the core of a lot of environmental policy that gets put forth. So these are really the concrete components of how we determine environmental policies. Then there has to be cost-benefit analysis. And so this is, of course, the costs of regulation, but also the quantifiable costs of doing nothing. And we've talked a lot about the process that happened in Europe. It's called the Delphi process to determine attributable risks. And those papers will be coming out tomorrow. But that was really trying to determine the quantifiable costs of doing nothing right now. It's the attributable risk from the environmental exposures. Even if that attributable risk is very, very small, let's say 5% of the entire obesity epidemic, you are still talking about hundreds of thousands of cases of disease and economic burden to society and the country. So then we haven't really talked a lot about who should be putting forth the policy. Should it be medical organizations? So that could be in the form of changes in medical school curricula. It could be the AAP guidelines to clinicians. Even within an organization, it gets complicated. Within the AAP, should it be the Council on Environmental Health? Should it be the Council on Endocrinology? The people who are tackling obesity? Should it be all of us combined? So that really gets at the complexity of even working with large bodies and organizations. Should it be at the state level? In Washington state, we've done limits on the amount of certain chemicals in children's products because of potential harm to children's health. But I can say that having sat on the governor's committee to implement these regulations, it's really, really difficult to implement on the ground level. Then there's federal reform. We've talked about TSCA and how it's really broken. What has been put forth is the Chemical Safety Improvement Act, and that was introduced in 2013 by Senators Lautenberg and Vitter, and was then taken over by Barbara Boxer, but hasn't moved forward in the legislative arena in recent times. I haven't really heard about it in about a year, but that's the federal level reform that could happen. So I put this slide in at lunch because we were talking about individual level advice in one of the discussions. And I think, Barbara, you asked, what do we tell people? So I'm a clinician and I'm an environmental health expert. I work in something called the Pediatric Environmental Health Specialty Unit, which is a national organization of networks across the country that's funded by EPA and ATSDR. We're charged with doing environmental health consults for families. And this is taken from one of the documents that we put together. And it's basically how to reduce your exposures to phthalates and BPA. So this is one of the questions on the handout. How do I reduce my family's exposure to these chemicals? And you can see the different recommendations here. The first one is buy low-fat dairy products such as skim milk and low-fat cheeses, buy fresh or frozen fruits and vegetables when possible, avoid canned and processed foods. I won't read all of these, but we have these plastic codes here. This is on the bottom of your water bottles and things like that. 3 can contain phthalates. 6 is, this is polystyrene. It was related to a different chemical here, but that's why it's on there. And then 7 is other, and it can contain bisphenol A. So we tell people if they really want to avoid certain plastics, those are the ones to avoid. But really, I tell people now to try to use stainless steel or glass when possible, because there can be alternatives that are as toxic or even more toxic in the plastics. So this is the kind of thing that we tell patients, that we give patients. This is the most downloaded document from the Environmental Health Specialty Unit's national website, thousands of downloads. But the problem with it is that there's not a lot of evidence to show that these recommendations actually lead to reductions in exposure. And that's the problem of requiring individual level action. And I'm just going to get into that really quickly with a study that we did at our own institution. So the problem here was that there's many different guidelines to counsel women on how to reduce environmental exposures. Jean Connery showed the UCSF materials, which are excellent. I just showed you our Environmental Health Specialty Unit materials, but none are evidence-based. So we wanted to determine if asking families to follow written guidelines would reduce exposures to phthalates and BPA to a similar extent as a true dietary intervention. And that was assuming that diet is the biggest source of exposure to these chemicals, which I won't get into now, but it's probably about 80% of the most toxic of those chemicals. So we did a randomized trial of 10 families with 2 children between the ages of 4 and 8. Arm 1 got a catered dietary intervention. Arm 2 got the educational handouts, similar to the one I just showed, although it's been revised since this study, but they received just those educational handouts. And this was our sampling schema. This was the pre-intervention, intervention, and post-intervention period. We got 2 samples during the intervention period, 1 pre, 1 post. And just to speak to Judy's comment, we've done this since and done 24-hour exposure samples and seen some similar results. This was what happened. We assumed in Arm 1 that we would see a lowering, because this was this catered dietary intervention that we provided the families with fresh produce. It was prepared all without plastics. We talked to the manufacturers and the caterer for weeks before we did this. Arm 2 was the educational handout where we didn't expect to see any changes in the chemical concentration. So just to orient you to this, this is the DEHP metabolite concentration, the sum of the DEHP metabolites, and this is on the log scale. And these are the different exposure periods, the pre-intervention, during the intervention, and the post-intervention period. And what you can see in Arm 1 is that we had a really large increase in phthalate concentrations during our intervention at the time that we asked our participants to eat this catered diet. And in Arm 2, when we asked them to follow the educational handouts, we didn't see any changes at all from pre to post. So this was really disappointing. And we had to tell our study participants that we actually dosed them with a bunch of chemicals, but unintentionally. And so I will just leave you with that, because as a clinician, it gets really, really difficult to advise people on these kinds of exposures. So when we talk about the policy realm, what do we tell our individual patients, and then what should we be doing at each different level, the individual level, the organizational level, state and federal? Thanks. Yeah, sorry, I didn't. So we tested the foods, and we happened to have a lot of those foods left over. We tested them, and it turned out to be in our ground spices. It was, the ground coriander was about 30% by weight phthalate.
Oh, wow.
Was it organic?
Yes, it was, but organic has nothing to do with those chemicals.